Thank you, Iman, for those great opening remarks that really set the stage for what we want to do. And thanks for recruiting me here as well back 6 years ago now. So our One Health Research Initiative launched in 2022 with funding from the state of Arizona. And I know we all love to complain about politics and politicians, but I really did enjoy getting to meet members of our Arizona legislature, both parties, to build this program and to obtain the funding for it and to create a program that all Arizonans could be proud of. We're now in the process of becoming the Center for One Health Innovation and Practice pending ABOR approval. Our goals are to advance interdisciplinary research, training, and community engagement at the UA by integrating human, animal, and environmental health. The center will support collaborative research teams, develop innovative tools and approaches to address problems such as zoonotic diseases, pollution, climate impacts, and food and water insecurity, and provide training opportunities that prepare students and professionals for careers in the rapidly growing One Health field. One of the ways that we do this is through our One Health Symposia. This is our 6th symposium, and the first that we are co-sponsoring with Ending Pandemics and with TGen North. I'd like to thank Haley and Griselda for all the hard work of putting together this symposium, as well as the many staff members who helped them. I'd also like to thank Mark and Dave for their leadership of Ending Pandemics and TGen North and their collaboration in hosting this event. It's great to do this event together, especially since the One Health Memorial keynote talk last night was named in honor of Nate Nieto. And I was a colleague of Nate's in the biology program at NAU before coming here. And Nate actually trained me in how to do work on wild-caught rodents in Yuma, where we still use the cactus mouse as our animal model. In addition to this symposium, we also offer funding to promote research in a variety of ways. This includes our $50,000 pilot grants and our graduate student fellowships. Both of these competitions are open at the moment for funding for next fiscal year. And we also hold competitions at different times for postdoctoral fellowships, grant writing workshops, travel awards, and student internships. Most importantly, I think, we have strong partnerships within the UA. This includes the College of Agriculture and Life Sciences. We have many people from that college here today. The Global Health Institute within the College of Public Health. The Superfund Research Center, which is in the College of Pharmacy. The Southwest Environmental Health Sciences Center, another College of Pharmacy, NIEHS-supported program. The Southwest Center on Resilience for Climate and Health, which is also within Public Health. The Western Region Public Health Training Center. The Environment Exposure Science and Risk Assessment Center, also within Public Health. And CNRS, which brings French scientists and collaborations into the UA fold. We have many other international partners as well, and we also work with tribes across Arizona. It makes sense that our One Health Center is involved with so many partnerships because One Health problems are inherently complex and require diverse expertise and creativity. So please consider this symposium as an opportunity to build collaborations and think about the future of One Health at Arizona's institutions. With that introduction to our program, I'd like to turn the mic over to Dave. Dave Engelthaler is the Executive Director of TGen North and the ASU Health Observatory, and also co-sponsor of this event, so coming from 2 other great Arizona institutions. Thank you, Dave.
Thank you, Frank, and thank you for agreeing to do this joint symposium this year. I'm Dave Engelthaler, as Frank mentioned. I'm the Executive Director of the Health Observatory at ASU, which you can see on the screen, as well as TGen North, where we really founded the Southwest One Health Collaborative 7-8 years ago. And with this joint meeting, this is also our 7th annual Southwest One Health Symposium, and I'm glad we're doing it together with this great program that you have built down here, Frank. It's very exciting. In the interest of time, I know that we're starting a little bit later. I'm going to shortcut some of my comments, but maybe just take it in a little bit different direction. I think we all have a sense of One Health and why we're here. I think about it in a few different ways, not just this trying to think about health problems from the human, animal, and environment sense, which is absolutely what we need to do. We need to be thinking about whole systems. But I also think about One Health as all of us coming together as one tremendous asset, especially here in the Southwest, to really tackle these health problems, from our wildlife biologists to our environmental scientists to our clinicians and our veterinarians and our genomic researchers and our bioinformaticists and more. It's that so many disciplines that are coming together, as well as so many different people, different leaders, whether some of us who weren't gray when we started and we've been around for a while, to the students that are here, and I'm so excited to hear some of the work that they're doing. It is really this ability, exemplified, as I mentioned last night, by Nate Nieto, to really be open and sharing and working together to achieve a singular mission, which is really advancing our understanding of health through a One Health lens. I think we can all do that. We do that by coming together in this symposium, take time to get to know somebody new, get to know somebody from a different discipline or from a different institute. That's a major reason why we have these, not just to hear talks from brilliant people, but actually so that we can make that collaborative happen. With that, again, I'm thrilled to be down here and certainly glad to be partnering with the University of Arizona and the great programs down here as we continue to expand and build this collaborative throughout the Southwest. With that, I thank you for coming, and hopefully it's going to be a great day for you all. And I'm going to turn it over to Dr. Mark Smolinski. Oh, actually, I'm going to turn it back to Frank. He's going to do the next one. So thank you, everybody.
So thanks, Dave. And Dave was also our keynote speaker at last year's One Health Symposium. And Mark Smolinski, who's going to speak next, was able to announce the launch of coming here to the University of Arizona at one of our One Health Symposia. So it's been great to connect all of this together. So Mark Smolinski is Executive Director of Ending Pandemics Academy. And actually, we're going faster than expected, so you have a little bit of extra time, Mark.
Great. Well, good morning, everyone. Since I have enough time, for those of you who missed my keynote, I'll just give it again this morning. No, but I did want to share a couple of slides, and I want to thank TGen and the One Health Center for inviting Ending Pandemics to be part of this great meeting today. So for those of you who don't know anything about ending pandemics other than those of the great audience that attended last night, I really appreciated that. We were a not-for-profit that operated on philanthropic dollars solely from Jeff Skoll, who was the first president of eBay, and we applied these funds to help really find and verify outbreaks faster in low and middle-income countries across the globe. And in the process of operating this organization for 10 years, it turned out we created 7 tools that were being used not only by the US CDC and WHO, but by countries across the globe because they were considered non-biased, open, for public good, and all supported by philanthropic dollars. So we were a 10-year spend-down organization, and so when we came to the end of our 10 years, we needed to find homes for all of these tools. And so the first one we moved was Global Flu View here to the University of Arizona, where my good friend Iman was my classmate from the first graduating class here at the University of Arizona College of Public Health. And it was her idea, why don't you move everything to the university and create the Ending Pandemics Academy? So we're really excited to be part of the University of Arizona, which was, a home to me many, many years ago. And what we're doing is we're bringing all of those tools here for students and faculty at the university, and hopefully to enhance the great work that they're already doing here, as well as to expand our approach in engaging civic, government, corporate, as well as academic leaders to really improve community health. And for us, we've always focused on One Health. Everything we've done for the last decade has been through the One Health lens. But again, because we were really interested in approaching the engagement of communities, participatory surveillance became our signature project, and it's something we're really going to focus on here at the university. So I shared this last night. For us, One Health is more than just human disease. It's also thinking about what's going on in the animals, as well as all of those different variables in the environment that impact on the emergence of infectious disease. So again, we really believe that the optimal way to implement One Health, which is part of the theme of this meeting, was really to create participatory surveillance systems. And those are to directly engage communities to be part of the solution. And so this is a resource that will now sit here at the University of Arizona. It took us 2 years to put this together. These are all of the participatory surveillance systems that exist and are active across the globe, whether they're strictly for animal health, for environmental health, for human health, or any combination of those. And it's really important to understand for us, participatory surveillance is the bi-directional receiving and transmitting of data for action by direct engagement to the target population. And this map you're able to use as a resource where you can click on any of these dots and they will give you the information about those systems. A bar will come up on the left that has who created it, what was the purpose of it, what are they tracking, as well as who's created it so that people can start to engage with systems that they're interested in by directly communicating with the people who created them. You can filter them by any of the particular subsectors, or you can look at ones that are multiple sector. If you know the name of the program or a country, you can also search for it that way. And again, the same information is available on each of these systems to really help drive more collaboration. You can also click on a thing that'll walk you through this map on how to use it, as well as we want to add systems if they're available, and so you can contact us directly. And we're hoping this will be a great project for students to take on who are interested in health promotion and One Health to really help us make sure that this map always stays up to date and includes any new systems that are out there. Again, we are really focused on participatory surveillance, and the way we've created participatory surveillance systems across the globe is through this process that we've coined EpiHack, and that's where we bring human, animal, and health experts from a particular country to work directly with technologists from their own country to co-create the solutions that are needed to really find and verify outbreaks faster. And these tools have been operating now in many countries across the globe and have had a huge impact on saving lives and protecting livelihoods. And we'll talk a lot more about that at our session after lunch. But we're super excited that the first project we're going to take on as the Ending Pandemics Academy is to conduct an EpiHack Arizona. And our goal is to create a One Health participatory surveillance tool for the state of Arizona where everyone within the state can be part of this system, because it's a great opportunity with a huge diverse community here, the agricultural community, the border state, and we're really excited to use the methods that we see are really operating well in low and middle income countries and see what we can do as a state. And we believe that Arizona could then serve as a model for the other states in the US to really promote direct engagement of communities. So our first step was a workshop that we had yesterday, and I'm really thankful that everyone who came to that really helped us think through what are some of the challenges and start to build our ideas for the EpiHack that we'll host in May. We are also going to collaborate with Hack Arizona, which is the huge campus-wide hackathon that this year will occur in April. And the Ending Pandemics Academy is going to be one of the sponsors, so we can put out the challenge of participatory surveillance. And if any of the teams accept that challenge and come up with great ideas, then we're going to offer paid internships over the summer to help us at the Academy further our work on participatory surveillance. But otherwise, the EpiHack Arizona itself will occur in May, the week after graduation, and we have lots of interest in that from the workshop yesterday, and many people came up after the keynote last night who are very interested in that. The EpiHack is basically 3 developers to 1 health expert. That's the ratio we use, where the health experts guide the developers and then work together to create the solutions that they want so that these tools are owned by the health experts and are able to use these open source tools developed by the community. So that's the overview of just a few highlights so you know who we are and why we came here, and we're absolutely thrilled to be part of the university. And we look forward to the session after lunch today where we'll share some of the outcomes of the workshop that we conducted yesterday at the Reed Park Zoo ahead of the opening reception. With that, I'll turn it back to Frank. Thank you.